member for Courtenay-Alberni.
Thank you, Mr. Speaker. If the provinces came to the government and asked, and the territories, and asked to procure safer pharmaceutical alternatives to the toxic drugs that are killing Canadians, would it act with the same urgency it did to procure COVID-19 vaccines and supplies?
The Honourable Minister.
Speaker, what I would say is if we go back to March 2020, when COVID descended upon us, we were in a very different situation. We didn't have one vaccine that was approved. Provinces and territories needed the assistance, which is why the federal government got into that procurement business, which is generally not what the federal government would do. Health care is provided by provinces and territories.
Member.
Speaker, the government keeps touting that safer supply is how they're going to respond to this crisis. Has the government looked into whether bulk buying harm reduction supplies or safer supply could help reduce costs for supervised consumption sites that are often facing funding challenges?
The Honourable Minister.
And Mr. Chair, what I would say is that the government has made significant investments in terms of the crisis that we have at hand with opioids, and the vaccines that we have procured were procured because we knew that we needed those vaccines across the country.
Member.
Mr. Speaker, people are dying in the minister's own community. Parents are losing their children. The drug supply in this country has never been more toxic. We need a paradigm shift in our drug policy, and we need a crisis-level response. You can save lives by procuring a safer supply. Will the minister raise this issue at her cabinet table and urge the government to act, and act now?
Honourable Minister.
As I've said, Mr. Speaker, first, Mr. Chair, I'm happy to work with the member. I appreciate his advocacy. Our government has made significant investments. The Prime Minister has appointed a Minister of Addictions and Mental Health. She is working very hard on this, and we have made investments, as I've said, of $800 million to support community-led harm reduction, treatment and prevention projects since 2015.
The Honourable Member for Courtenay-Alberni.
Mr. Speaker, the government created an expert task force on substance use. It included police chiefs, top medical health professionals, people who work on the front line, people who use drugs, family members that have lost loved ones, experts on substance use. The minister hasn't read even the executive summary she admitted to earlier in this report. So my question to you, will the minister do the right thing and at least read the report, because it does include safer supply? And will she support my bill and at least getting it to committee to listen to the experts and see if there's a way that her cabinet post and her department can help contributing to saving lives?
The Honourable Minister.
Mr. Chair, what I would say is that I appreciate the impact that this is having. And I am, as a part of this government, always willing to work to address this crisis. But we have made investments. We have taken measures. And these investments are making a significant difference. And there is more that's going to be done. And I know that the minister responsible is taking strong action. And I look forward to the future steps that we are going to take. But significant investments have been made, $800 million since 2015 in this regard.
The Honourable Member.
I think her government's doing a good job to respond to the toxic drug supply crisis.
Honourable Minister.
I think that our government is seized with this, and we're going to continue to implement further measures in addition to the $800 million that we have committed. And I know that the Minister of Mental Health and Addictions is working very hard on this matter.